Alright, so now we're going to do the heel wound, the third of the complex wound. We have the stomach, which we've shown, the thigh, just like the stomach, except one 4x4 gauze packing, and then this is the heel. I personally think the heel is the easiest, but students don't like it when they get the heel because they usually don't practice it. So just practice and you will be fine. I'm going to use my towel or pad so that I don't get the linens wet. My patient's in an uncomfortable position, but I have talked to my patient and explained that I need to do this procedure, so he can let me know if it becomes too uncomfortable. I've medicated him if he needs anything for pain, and we've gone to the bathroom, so he is okay in this position for a little while. Clean gloves to remove the old dressing. First, some supplies. So my sterile water, tape, measuring device, my angiocath, 35 ml syringe, my conforming gauze is what I call it, or gauze roll, 2 packages of the 2x2 gauze, and there's 2 in each of those. And I only need 1 package of my cotton tip applicators, 2 pair of clean gloves, and 1 pair of sterile gloves. My biohazard bag is already on my table, and again, I want you to just kind of look at my setup. My tray is all the way over the bed. It's not off to the side over here, okay? So I'm not doing a lot of twisting, so nothing's going to be out of my field of vision. So clean gloves, remove the old dressing. If you've got bandage scissors, you can use them, just be careful. Do it the old way, which takes a while. And notice I'm wadding this up as I go so it's not draping all over the bed. Oh, no. Okay. Well, my packing just fell onto the floor. I'm actually going to leave it there, and I'll kind of take note of what it looks like because since my wound's open, I don't want to bend down and pick that up, okay? So it's gross, but I am going to take care of it before I leave the room, okay? So remove those gloves. You can throw them in my trash can here or in my bucket. New gloves on. My Q-tips. Alright, so this one, you can't really cross over your wound because you're parallel to your wound. You're not over it. So you can do width. Usually you do length first. So the length is going to be from head to toe, so top to bottom. And don't touch the wound, just hover over it. 3. Dispose of that one. Use my new one for any tunneling. And my depth. It's tiny, like half. So 3.2.5. Okay. So that's that. Now I'm going to set up my sterile film. So again, opening everything all the way, because you're going to do it one hand sterile, one hand clean. Sorry, I have the door open. That's probably you guys in there. again, I tape everything down to my table. You can do whatever works best for you, okay? Loosen my syringe cap, but don't expose it, okay? It's still covered. Sterile water expires June 2018. And then break the seal on my Andrew cap. I kind of just dropped my hand there a little low to dump in my trash can, so it's probably easiest just to use this bucket so you don't drop your hands. And again, this entire thing is my sterile field, so keep within that 1-inch border. Okay. This makes you more comfortable. Alright, so now again you can do dominant, non-dominant, whichever you prefer, just get one of them. Sterile. It's tight. Okay. Where do I want to go first? So I'll do my angiocath. So again, I'm knocking off the pink without touching the clear catheter inside there. So brand new, date, time, and initial that, palm it, label and palm, and pour it in our little container there. Okie dokie. Is that everything? Oh well, we'll figure out, right? So this procedure is all in preparation. If you forget something, you're going to be unsuccessful. Alright, so it didn't come down over my watch. Probably should have taken that off. But I'm not going to worry about it because I'm going to end up contaminating this hand if I try to pull it down. So again, first things first. Right. Now this is a sharp, so do not throw it in the trash. You will be unsuccessful if you put this in the trash can. This needs to go in the sharps container. It's a big pet peeve. And then irrigate. You want with the flow of gravity, so the top to the bottom. You know what? I didn't palpate this wound. So when you're measuring, you need to palpate, and again, you're not crossing over, but you're doing your palpation from top to bottom, which is actually head to toe, so you're going to palpate one side and come over and palpate around. I guess since I remembered on my own, I passed, right? The instructor didn't have to remind me. So I'm going to clean the same way. So I'm going to clean top to bottom one side. And it's backwards, it's upside down, right? But your top is your head to toe. There. Okay? 2 packing. 1 is going to go in my water and get nice and wet. And then I'm going to make a cute little, I don't know, round oval disc. My dry gauze is going to go over the top of that. And I'm just going to put it in there. Hold it on. While I get my gauze roll or my conforming gauze and wrap this thing. No special procedure on wrapping. People usually do 8s. Alright, so that's it. Once I get this wrapped in tape, just one piece of tape at the end. Preferably the tape needs to be on top of the foot, because if they get up and ambulate with this, you don't want it coming undone because you put your tape on the bottom. Date, time, and initial. I'm going to throw this in sharps, and you're done.